So in the last video, I have mentioned about adrenergic agonist and adrenergic antagonist. So what are agonist and antagonist? So before knowing about agonist and antagonist, we have to understand the term affinity and efficacy. So what exactly affinity is? In technical term, the ability of the drug to bind to the receptor. See, this is a drug. There is a drug. So this drug will come and bind to its receptor, and the receptor and drug are specific to each other. Almost most of the time receptor and drugs are specific. So the ability of the drug to come and bind to the receptor is simply termed as affinity of the drug for the receptor. You know why for the receptor? Because they are specific to each other. Now, after binding to the receptor, this drug will show its pharmacological action. So, efficacy is, in technical term, the ability of the drug to elicit its pharmacological response. The ability of the drug to elicit its pharmacological response is simply termed as efficacy. Okay, pharmacological response. Now, we have to understand what is agonist and antagonist. So, agonist, in the case of agonist, the drug will have more efficacy. See, in the case of agonist, the drug will have more efficacy, more affinity, and also more efficacy. Okay, both will be more. So this is the drug. It will bind to the receptor, and it will also show more affinity. That means it will bind tightly or properly. It will bind to the receptor, and after binding, it will also show its efficacy properly. It will show its pharmacological action. That's why more efficacy and more affinity also. Listen, remember one thing, the efficacy is sometimes also called the intrinsic activity. It is also called intrinsic activity. Okay, so some people will say like this also, that agonists have more affinity and they will have more intrinsic activity. So it also has more intrinsic activity. Now this is in the case of agonist. Now in the case of antagonist, what we will get, that it has again more affinity. So the drug will bind properly to the receptor. So it has more affinity, but it has very less efficacy. Very less efficacy or intrinsic activity. It has very less efficacy or very less intrinsic activity. That means after binding to the receptor, this drug will not show any, or it will show very less pharmacological activity or pharmacological response. Okay, in between these two, agonist and antagonist, we will get another. The term is called partial agonist. It is called partial agonist. So what are partial agonist? Partial agonist has affinity almost equal or little bit less, affinity almost equal or little bit less than that of agonist, but it has less intrinsic activity. That means it will almost have same or little bit less affinity to bind to the receptor. Okay, but it will have little bit less efficacy, not so much less that it will act as an antagonist, but it will have little bit less. So affinity is almost same to the agonist, but it has efficacy or intrinsic activity little bit less than that of agonist, but it will have more activity, or it will have more intrinsic activity and more efficacy than that of antagonist. Okay, example of agonist are dobutamine. It is called dobutamine. So dobutamine, I hope you heard about the name of the drug. Dobutamine is used to stimulate or enhance the activity of beta 1, to activate the beta 1 receptor. Whereas example of antagonist is propranolol. Propranolol is a non-selective beta receptor antagonist. So it will also act on beta receptor. Okay, thank you.